Today we're discussing from embryo transfer to delivery, the medical side of surrogacy. Surrogacy is not the typical pregnancy that most surrogates are used to. Most gestational carriers are excited to pursue surrogacy because getting and being pregnant were easy and enjoyable for them. A gestational surrogate pregnancy involves working with a fertility doctor to achieve your pregnancy. This is new territory for many, so let's walk you through that. Since your eggs are not used to achieve the pregnancy, the embryos are already created at the intended parent's fertility doctor and are frozen and waiting for the right carrier to achieve the pregnancy. Now you come into the picture. The fertility doctor will evaluate your uterus during your medical screening. There are various methods for this evaluation, and the fertility doctor will educate you on their preferred method. Once you receive medical clearance, the nurse coordinator for the IVF doctor will issue a medical calendar outlining the days you will take medications. They will place an order for the correct medication to be shipped to your home and give you all the instructions for how and when to administer your medications. You can have someone at home or work help you with the injections and medical protocol. Even if you decide to self-administer the medications, you always need a backup plan for someone to help. Following exactly medical protocol is one of the most important things you can do for your journey. You can't forget about a day and make up for it the next day. These days are specifically and scientifically planned out for everyone's success. As you prepare your body to receive the embryos, the doctor's office will give you medication to suppress your ovulation as your eggs are not being used. Ovulation typically triggers your body to produce the hormones necessary for the uterine lining to thicken and receive a fertilized embryo to implant and continue until a positive pregnancy and beyond until the first trimester. The embryo transfer is painless and quick. The embryos are loaded into a small catheter by the embryologist, and the IVF doctor will transfer the embryo by passing them through the opening of your cervix during the embryo transfer process. You will continue with injections to thicken and make receptive your uterine lining for the embryo to stick and stay while it's implanting and making a healthy baby, and then we have your blood test to measure your hormones, indicating a successful pregnancy. Once confirmed pregnant with a blood test, you will continue on the medication and attend blood work and ultrasound monitoring to ensure that the baby is continuing as a successful pregnancy. Once the fertility doctor is happy with the pregnancy's process, you will graduate the care to your OB-GYN in your community, covered under your suitable health insurance for the remainder of your pregnancy. Here at Choice Surrogacy, we do require that your doctor is associated with a level 2 or 3 neonatal unit, just in case we need them once the baby is born. At that point, you are considered a typical pregnancy, with a whole cheering team in the delivery room, welcoming the baby into the world. This is a quick overview, and we encourage you to ask any questions you may have directly to your doctor. We are not medical professionals and encourage you to get the facts directly from medical professionals. If you have any more questions or need any further clarification, feel free to reach out. We're here to support you every step of the way.